Hi, Dr. Bradley. Thanks for
Hi,
being here.
wonderful. I'm so happy to join you on this wonderful platform that you have.
So, for the women listening and for our audience, some people have heard of functional medicine. It's becoming more of a buzzword, and other people have not yet heard of it. So, can you just tell us what is functional medicine?
Absolutely. So, functional medicine looks at upstream causes of chronic disease, and it uses food and nutrition as medicine to try to figure out how can we get to the root cause. So, it has very similar ideas similar to like lifestyle medicine with nutrition, but it looks more at, we call it systems biology, a network of how our body works together in unison. So instead of focusing on one organ, it focuses on different parts of the body that may cause inflammation, for example.
So, functional medicine is different because I hear you say a key word, which is root cause. So, the difference of what functional medicine is versus traditional medicine when we all go to our doctors is that when we go, we often are dealing with, or our doctors are dealing with our symptoms. Is that what you're saying? And when we go to a functional medicine doctor, they're not trying to take care of our symptom. They're getting to the root of what is causing the symptom.
Kind of, but let's back up just a second. So let's say, for example, that you had joint aches and your blood work was pointed to maybe a diagnosis of rheumatoid arthritis, RA. So a basic physician would diagnose you with a disease and then treat that disease. Functional medicine would look at that and say, well, what is the cause of this inflammation that you're having in your joints? Is there something environmental? Is there something nutrition? Is there something in your gut, i.e., like gluten sensitivity or celiac disease? So we would look a little bit further upstream, we call it, and look at the root cause of what's happening.
In the framework within this healing power growth platform that we have here, a lot of um, what we're looking at is things related to trauma, right? So there's what we call big T trauma and little T trauma. And we focus more on the little T trauma, although it all plays in. And so, in that framework of everyone has been traumatized, right, somewhere in their life, um, that experience, that processing or not processing of that trauma causes things in our bodies like inflammation, like other things. And so, in that framework, I'm I, I would love to hear, what it is that you're seeing when patients are coming to your practice. What are those typical symptoms within that framework are you seeing, and how is that something that functional medicine in your practice is able to address in a different way than traditional, going to their family doctor?
Hmm. That's a great point. Think about it this way. We have a lot of patients that have chronic pain, or they may have had a diagnosis of fibromyalgia. They may have headaches, migraine. They may have situations where their body, they don't know why they're having this particular pain, but then or even autoimmune disorders, we have seen this a lot. So we look at it from the standpoint of what's causing the pain. What is the inflammation that's causing the pain? And digging down into the root cause, we end up having a lot of patients have had, as you said, the little t, the little trauma. They may identify it or they may not have. And that's part of the exploration is trying to get the patient to identify their own quote unquote little t's and connect the dots. So then finally, when we come to working on the healing process, they actually understand that all the things in their life have contributed to a lot of the symptoms that they're having right now. Um, we use a lot of mind body medicine because when you have a lot of stressors in your life, so what are stressors that a typical person has? Back in the years ago, they always use this analogy of, like, the tiger that you see, and all of a sudden your cortisol level goes up. Well, we know just commuting, like Cleveland, is traffic, for example, in the city, or all the demands of having to place on, like, your family, children, your job, just everyday living can create so much stress, and that we're constantly driving cortisol. Cortisol is our stress hormone that comes from our adrenal glands, and it can be unchecked. What does that mean? It's constantly on. We don't know how to turn it off. So that's what we kind of work with patients with the mind body medicine component, and trying to get their cortisol levels in check, reducing them. There's that term I use, is that resiliency bank. I don't know if you've heard of that before, but it's ways that we can increase that so that we can handle the daily stresses that come to us. There's a wonderful work that's being done around the vagus nerve. You probably have read things about that and what it does in our body. And we try to work with patients, because a lot of our patients have never even heard of that before. Like, what is the vagus nerve?
And I was just going to say, so let's if we can, just in the description of what you're talking about, for those who have never heard of the vagus nerve, as it relates to, you're talking about, so someone's going to you, they have symptoms, as you were saying. I just want to kind of break this down. So I come to you because I have, am I coming to you after a diagnosis, or because I don't yet have a diagnosis?
It could be either. It could be that you just don't feel well. You may have brain fog. You may not understand why you're feeling so horrible. Or you may have had a diagnosis, but you're not sure that that maybe is the actual diagnosis. So there are
So
many reasons. Yeah.
I can say, so in my situation, I didn't know, right? So I'll use myself as an example. I had lots of symptoms that my traditional doctor, no one could figure out. They weren't things that really showed up on a test. There's no way to test for brain fog. Um, Head to toe body pain, gut distension, digestive issues, fatigue, uh, all, all kinds of, things that, so I come to you, right?
Hmm.
And for everybody listening, this is the appointment that no one can get. So really take this information here. So we come to you at Cleveland Clinic, world renowned, and no one's able to figure anything out, right? Because it doesn't show up on a test. But you have different things that you look for, different tests that we take, right? That traditional medicine doesn't take and doesn't account for. And then in part of that questioning, you bring up the vagus nerve, because you're talking about mind body stressors and things like that, because you're getting to the root of what is causing this, not just assuming something is going wrong. So, what is it in my life that might be causing that? And I think that that's something that a lot of us haven't really thought of, right? I mean, I just think
Hmm.
I'm getting older, or things are falling apart, and it feels like a very helpless place to be. But it's it sounds like we're in a place now where functional medicine is here, and uh, we're able to take control, because we now realize that there are other factors that play into this. And you're saying that cortisol and us being stressed with the things that go on in our lives can actually create this sense of pain, because it creates a chemical interaction in our body that's
Hmm.
stimulating in a negative way all of these things. So the vagus nerve is what and how does this play into?
So the vagus nerve is a very old, primitive type of nerve in our body. It starts in the brain and it regulates many different parts of our body, from our swallowing mechanisms, our heart rate, our stomach contractilities and release of gastric juices. So it really goes straight from head all the way down to our intestines. And when it's dysregulated, that means that the vagus nerve is either turned on or it's not working, turned on too much, or if it's not working, it can affect many different facets, from our swallowing, our heart rate, our gut, and our digestion. But also it can contribute to either plus or minus, good or bad, as far as like neuroinflammation. If it's affecting our gut, which there's a term we use, which is called leaky gut. GI doctors prefer to call it gut permeability, where it's almost like a cheesecloth image, where you're seeing things that are released through our intestinal wall that should not be. And then this gets into our bloodstream, which then goes and causes neuroinflammation in our brain. So that's how the gut brain axis works. And it's bidirectional. How we think and stress can affect our gut, and our gut can affect our neurotransmitters to our brain. So it definitely is a process that we know that we need to work on. Like you mentioned, some of those specialized testing. One of them is looking at the gut microbiome. But how we work with the vagus nerve is, when we talked about that resiliency bank, those are one of the things that we work on we offer exercises, believe it or not, that are really simple things that you can do to help regulate your vagus nerve so that you have better heart rate variability, which I'll go into a little bit more in detail. But also it helps with your gastrointestinal secretions to make sure that your gastric juices are maximized so that you're able to break down your food and get the nutrition, be able to extract the nutrition from our food, and also with your intestines so that we have our motility. When you mentioned a lot of the bloating that individuals have, a lot of it is because they are not breaking down their food, or maybe they have a food sensitivity, and they are also not able to, we call it intestinal motility, where how the fast our food and whatnot goes through our intestines. Sometimes it can be slow and dysregulated, and that's where the vagus nerve helps in that component.
So basically, if you're a woman listening to this and you are living a really typical life, which means a really atypical life, we are living under extreme stress. If you are a woman who really can relate or resonate with feelings of anxiety, being highly emotionally triggered, um, negative self dialogue, negative self talk, self limiting beliefs, right? So many of us suffer from this. Those are, I would say, three things that come out of trauma and activate a flight or fight or freeze response in our bodies. So many of us have the negative self-talk, self-limiting beliefs, anxiety, negative mindset, emotional triggers, and that leaves us or puts us in a state of chronic fight or flight mode. And when we are in that chronic fight and flight or freeze mode, that releases the cortisol, which then is an inflammatory response that affects our vagus nerve, which you're saying affects the entire communication between our gut and our brain. And also, so when that is dysregulated, that causes other subsymptoms of motility, right? So that
Mm-hmm.
means how we're going to the bathroom. So many of us are either constipated or, it's the exact opposite, or mood, mood dysregulation, right? Not only
Mm-hmm.
emotional triggers, but so many women are saying, like, my moods are so erratic. And this is all tied together, right? So for women who are feeling and can resonate and connect with any of these things, emotional reactions or physical symptoms that we're talking about, you're saying that it's because of those emotions that we are, again, setting off or living in a state of fight or flight and creating a toxic internal chemical release
On the
that
cellular
happens.
level. Yeah, exactly.
And that is creating, um, Dr. Bradley, so, I had read that it's, what is it, like 70 or 80% of our mood um, hormones, serotonin, and that make us happy or make us angry are made in our gut.
Mm-hmm.
Is that
Our neurotransmitter, serotonin. And when they talk about the gut is almost like our second brain because it does make neurotransmitters that affect how good you feel. And if so many patients I see that they have, we call it really severe gut dysbiosis, which means a lot of extra bacteria that they don't need or not enough of the good bacteria that they need. And it's driven by what? Stress, diet, what we put into us. Medications can do it, non-steroidals, steroids, antibiotics. All these things can affect our gut microbiome, which are the bacteria, that then in turn will affect how well we're able to make our neurotransmitters that then have an effect on the brain. We find that especially with the chronic stress, I could make you have the best diet in the world. I can have you sleep really well. I could have you start walking and movement and exercise, but if you are not addressing the stress, it will just undo everything that I've done. So it really is a multifaceted approach that we need to do, not just one thing. And I think that's the most important thing that we focus with functional medicine is not just one, give you a pill and you're going to get better. You have to want to, the term you use, lean in, right? You have to really want to be able to, to be and feel better, put the work into it. But I have patients that, quote unquote, a year later, I know it's a year, they'd rather have it be like a month or two, but they come back and they're just saying how wonderful they're feeling, they're thinking, they're sleeping better, their cognitive ability is better. But it doesn't end there because we can, once again, undo it very easily if we go and have a horrible diet, or if we continue with the unrelenting stress without approaching the stress head on. And that's where the mind body medicine is really important with in terms of when we talk about vagus nerve, we talk about how things that we do through meditation, through yoga, I can go into some exercises to help regulate the vagus nerve, that in turn helps us long term. And we can tap into it. You know what I love about these approaches is I'm always all about the self-help. Sometimes we have to reach out and have others help us. But once you can learn certain things that help you, you could do it. It doesn't cost money. You could do it anytime. And we know it works. So there's great studies to support a lot of the things that we're recommending.
so? I think that there's, some really big takeaways in this, that women who are suffering from mood fluctuations, you hear Dr. Bradley say this is related to stress and food. So, for all those women, it seems like for so long, you know, we have not discussed what we're struggling with. And then when we finally do, it's so siloed. So you get sent, you go to your primary doctor and you say, you know, um, we probably don't even tell our primary doctor that our moods are all over the place, right? That's
Hmm.
typically something we keep to ourselves. Um, but that there are all of these, again, symptoms, and we just think it's because we're stressed out. Well, and it is. But that it's something that's very controllable as opposed to how we've been dealing with it and how it's been dealt to us that, oh, you have these mood regulations, you need to see a therapist and you need medication, right? Everything is about medication to quiet the symptoms. And it's just dealing with the symptoms. And here with Healing Power Growth in this platform. And I'm so excited that, we have you here today because it is literally the hardest thing. And I don't want to, to make people feel like it's impossible, right?
Mm-hmm,
But
mm-hmm.
functional medicine is not something that, a most people know about, which is why we're so excited that you're here today. But it's also traditionally out of pocket. So it's not something readily available for everyone. So I want people to know that there are takeaways that Dr. Bradley will give us today, like you were saying, some exercises to help regulate the vagus nerve, and that this is for women who you need to be ready to do the work. This is
Mm-hmm,
not the
mm-hmm.
place where you're going to come if you want a pill. This is, like you said, you need to be ready to lean in and do the work and the heavy lifting. It's not easy. It's a time commitment, but this is really when you want to take your health into your hands and make a difference in the direction of your life so that you can take control
Mm-hmm.
and feel your biggest and best and healthiest and most aligned self. And you get us there by, what does it look like? So
Absolutely.
we come into you like, what does that appointment look like?
Mm-hmm. Thank you, Blair. And the one thing I do want to mention is that the Cleveland Clinic, it is insurance-based, and it's one of the few, if any, insurance-based functional medicine practices in the U.S. And so I'm excited that we have that offering for patients. But typically, the first visit you would come in and would be an hour assessment with your provider, who is a physician or an associate provider, like a nurse practitioner. Then you would have another visit with the nutritionist and then with the health coaching. And then subsequent visits could be with all three or just with your provider, depending on your specific needs at that time. And the first thing we look at is obviously nutrition, right? So we kind of, what we say is we take the bad things out. So what are some of the bad things? We may be able to say, yeah, I know it's the chips and maybe the soda, but let's dig a little bit deeper. You could have a sensitivity to gluten. We've mentioned that before. That is the protein that's found in most wheat products, but there are other foods that have gluten in them. And then we would take away corn, because that's another very known, we call it an allergen, but it's a sensitivity. Peanuts is another one. Some people have sensitivity to eggs, dairy, and then obviously all processed foods, caffeine, and alcohol. So we start with something we
Now
call the,
that sounds really overwhelming to people listening. They're going to go,
yeah,
"Oh my
yeah.
God, how am I going to survive?" So all of that gets cut out,
So what I
or
try to reframe it is saying, what can I have? Ah, okay. So let's focus on what I can, because your response is exactly what my patients say. Like, you got to be kidding me. And sometimes we'll meet you where you're at. What is that? Like, maybe we'll just start with the gluten, the sugar, and dairy to begin with, because we know that they are all very pro-inflammatory. Ah, we're going back to that word inflammation again. But so back up. So then we focus on what? Clean, really clean sources of protein, which could be a chicken, a fish, like a wild bison or something that is actually really clean. And then all the vegetables that are healthy for us, all the greens and all the fruits that are lower glycemic, so a lot of berries, kiwi, those types of things. Good healthy fats.
and lower glycemic. So what does that mean for people listening that don't
Oh,
know
okay,
what
that's a
that
good
is?
question. So they developed this glycemic index for food, and they used the basis of it with eating like a piece of white bread. So if I were to eat a piece of white bread, how high does my sugar go up? And if my sugar goes up in my blood, that forces insulin to be released. And then chronically, you may have a chronically high insulin level, which then in itself could cause inflammation and actually can contribute to a lot of the chronic diseases we are seeing, such as prediabetes, diabetes, obesity, which then in itself is related to what? All the chronic cardiovascular, hypertension, and even cancers. So backing up, what we do is we compare foods that have either high glycemic index versus a low. So what would be a low glycemic index? That would be a grain that has a lot of fiber in it. So pick like quinoa, for example. Quinoa has a higher amount of protein and fiber so that you're not going to have the elevation in the glucose like you would with having a slice of, i.e., white bread, which has no basic fiber, or it really is a poor source of
Okay, so
nutrition.
takeaway, write down quinoa on your list of things
And you
to
can
be
have
getting. And you were saying clean proteins, chicken and fish and
healthy
bison,
fats, uh-huh,
healthy
nuts
fats.
and seeds, avocado, olive oil. You know, fats had been demonized back in the 80s. And I can't believe I was a nutritionist back then. And we used to say, oh, have your non-fat Dannon yogurt that has all this sugar and carbs in it. When we talk about that glycemic index, that's just going to throw up the glucose versus having something with fat in it that's a healthy fat, like nuts. And I'm so happy that we've come full circle in really emphasizing whole foods. I think the big takeaway is whole foods that you can see, an apple versus a apple pie, which is a processed version of our delicious whole food, which is an apple. And to really focus on most things that you could actually identify, or I usually say, if you can't pronounce the words on the label of the ingredients of what you're eating, you shouldn't be eating that. And then
So
once
it's
again,
basically something that comes in at so if there's a label on it, you probably shouldn't be eating it either, right? So
ideally, right.
so your fruits and vegetables and things that you actually see out, your fish and proteins and things that are not processed and in a bag. So food that is healthy and whole
Healthy and whole.
helps decrease sugar, helps stave off those diseases that you talked about, and helps with um,
Mood.
gut, mood,
Mood.
mood and
People don't,
gut.
yeah, people don't realize that like sugar and highly processed foods, they when they drive the glucose up, that drives the inflammation, that affects the gut, that drives the quote unquote, they don't have enough uh, precursors for the neurotransmitters. And you also are going to be having that neuroinflammation that then can affect your mood. Have you noticed, like sometimes after you've eaten something really sugary and sweet, you just feel like garbage, and your body just feels sluggish. That's that goes back to that whole thing of the glycemic index of the glucose with the insulin, and it just shifts everything in the body. And also sugar, a lot of sugar will change the bacteria in our gut, and our bacteria in our gut also are responsible for our moods. Certain bacteria can promote anxiety, and that's the whole idea of when we go back to gut healing. So you take away the bad food that we had mentioned, you put in the good food. So those are all the real healthy fruits and vegetables. Ideally, this is really hard, but like 9 to 11 servings of fresh fruit and vegetables a day, like a half a cup is a serving. So having a big salad could really give you almost up to like 5 to 6 servings right there. But it's really hard to really get those foods in. And I usually tell my patients, you know how people are craving sweets or they're craving this, and I will challenge them and I'll say, are you hungry enough to eat a whole apple? If you're not, then what is driving this craving? And typically it is based with your moods. It's based on an unmet need that you're not aware of. And that's where you really dig deeper. You dig deep into what is the real source of quote unquote my cravings or my food choices. But one thing I have found, which is really interesting, We're having an increase diagnoses of ADD, ADHD, not only amongst children, but also amongst adults. And they weren't diagnosing it back years ago. But I have seen a direct correlation with our poor food choices, binge eating, and uncontrollable eating or poor food choices with when we have a craving based on ADD and ADHD. Because if we need to make decisions or we need to really work on something in our lives, when you have the ADD type of thing, you don't have you can't focus, right? So it's easier to eat something instead of focusing. But also, we're finding a lot of highly processed foods and sugar could be driving it. So it's sort of like one begets the other. And it really goes back to take out the bad things, put in the good things. I can't tell you the number of patients that have come back like 2 to 3 months later and they said, I have never slept so well in my entire life. They're like, I can't believe it. I mean, and if you're not sleeping, you're not doing what? You're not emptying the garbage out of your brain. That's the key thing. And sleep is critical for cognition, memory, energy. If you don't sleep well, you don't have the energy to exercise. You don't have the energy to make the right food choices. And you just want something quick and easy. So it really is, when we talk about, I love the analogy of like a bicycle wheel and all the different spokes that go down to the center, that you really need to engage all of those different spokes of your health care. And that's the sleep, the exercise, the nutrition, love, relationships, all of this to create the best version of you. And that's the center. And that also decreases many different chronic symptoms, which would be the inflammation. It could be your gut symptoms, your brain symptoms. I think in this era over the last 3 years with COVID, it really taught us a lot about inflammation. And we are finding that if you do address all these different areas, that you really can help yourself, and we could help patients. I mean, it's been wonderful to see the transformation with looking at all the different facets of functional medicine. One thing I didn't mention with functional medicine, just as a quick hot second, is we also look at gene and your environmental interactions and environmental toxins, intoxicants. And those are really important. Just like we talked about, processed foods are like contributors, toxicants are also contributors. And what's an example of a toxicant? It could be the byproduct of cigarette smoking and how they make cigarettes, for example. It could be pollution. It could be mercury, heavy metals. It could be our water supply. Look at what happened in poor Ohio with the train wreck and all the chemicals that are released. That is going to affect your body in some way if you live in any of that area. Or I found when I was in Cleveland, and remember, I don't think it was like 3 or 4 years ago, the fires in California. What they
Yep.
found is I actually was looking at the particulate matter in the sky in Cleveland from California. And what they have found is from the burning and a lot of things that were happening, there was an increase in mercury being released. And when you see this, all of a sudden you could do all this wonderful thing in life that you are trying to work on, your diet, your exercise, your sleep. But also we have to think about pollution and our environment as a whole to help us try to heal and get the best version of ourselves.
What are some of the foods that are high in mercury? I know I love sushi, and I understand that there's a lot of mercury,
Yeah.
and you have to be careful there. So, what are some of the things that we need to
Mm-hmm.
be aware of?
Sure. So the biggest contributor are fish. And so which fish? So think of the big fish. So big fish live longer. Big fish eat little fish, and that over time they accumulate more and more mercury. So the bigger fish, such as swordfish, tuna is the big one. And sushi has a lot of
And people think
tuna.
that they're being so healthy by eating tuna steaks, swordfish steaks, salmon, things like that.
Tilefish grouper. Now, salmon is still a really good fish. It has a high amount of fat. We call them the omega-3 fatty acids, your EPA, DHA, which are extremely helpful for brain health, inflammation. I've only had maybe one or two patients over the last 7 years that they ate probably like 4 or 5 times a week salmon, that their mercury levels were higher than they should be. So if
And
you
what are symptoms if you have too much mercury in your symptom?
Absolutely, and that's one of
what
the
are signs of
drivers
that?
when we talked about like that rheumatoid arthritis, for example, like high mercury can contribute to inflammation. It can actually contribute to, we're finding a lot of the heavy metals, but mercury in particular, with our brain health. And for women, it has some impact on our bone health with osteoporosis, and with all individuals, thyroid. The thyroid is really sensitive to mercury. And then even our kidneys, because it gets stored in our body. But the other things that are concerning are things such like lead, and we know that from Flint, Michigan, that was huge, especially with cognition and brain development. And then cadmium and arsenic. Those are like the metals that we worry about. But backing up to mercury for a hot second, the tiny little fish like anchovies and sardines are low in mercury because they're the smaller version, right? They're the small fish, and they're really healthy. And we don't eat enough of them. Other cultures, like in Italy and whatnot, they tend to have these on a regular basis. And we might have a little bit here and there in terms of like a sardine. And you can actually get some really good sardines that have olive oil and sometimes mustard or garlic with it. That helps, I think, with the flavor, because either you like sardines or you don't like them, and you want them to be wild caught. Now, grouper and tilefish are other two fish that tend to have a higher amount of mercury. And if you have salmon maybe 2 times a week, you should be okay overall in terms of your mercury level, but you can have it checked. You can have a blood test that will tell you how much mercury you're ingesting and is it affecting you.
And if someone sees that they have high mercury, is that something, if they just cut those foods out, that it will automatically go down, the body will regulate?
It will help with that, and it depends on how many years they've been doing this, because don't forget, we go from our blood then to other parts of our body to store things when the blood level's too high. So that means it'll go into fat, it'll go into tissue, and it could go into, for example, some of the metals can go into bone, which I have found, this is really interesting, that as women go through menopause, you have a higher turnover of your bone density. And that actually, we're seeing a release of some of these heavy metals coming out of the bone at that time. And they actually are impactful in contributing to osteoporosis.
So, what if you are a woman who is going through menopause and has high mercury, right? And and you're saying symptoms of that are osteoporosis. What what do we do? Is that something that we can do on our own, or is that,
So the first
where
thing
do
would
we go with that?
be, yeah, that's a great question. So remember, osteoporosis is a diagnosis, not a symptom. But if you have a pathological fracture, let's say you are just walking and all of a sudden you get a fracture in your spine, that is definitely the pain is a symptom related to the osteoporosis, which is the fragile bone that we have. So if you find that you have high mercury, for example, the first thing would be to stop the source. So that would be, let's say it's tuna. Like I have some patients, oh my goodness, they're having tuna fish every day. And I just went, okay, there you go. So let's put salmon, and you could do like salmon salad instead of like tuna salad. So the other thing we do is you can do a natural form, we call it a detoxification or chelation, where you could take certain foods that help you detoxify the heavy metals. So
Oh, what are they?
cilantro. Who would have thought? Parsley. These are actually helpful in your ability to detoxify.
Is that in the kind of quantities that, I mean, you're not having to have bowlfuls of.
It's, you know what I say, it's all, they all contribute. So one thing you have to understand is your liver detoxifies almost 99.9% of everything. And it goes through phase 1 and phase 2. And then we either urinate it or we eliminate it via our bowels. And this is how, or we sweat it, right? Sweating is another form of detoxification. So we support your pathways with nutrition. And if you're not able to get enough of nutrition in terms of antioxidants, you probably have heard that word before, but what are antioxidants? In particular, something like vitamin A, vitamin E, vitamin C. These are all great sources of, they come from food, but also antioxidants that help our body help move these toxins out. And then you could also add in more fiber. That's another, we could go back to fiber. Fiber is like a huge thing in being able to get rid of toxins. Even something simple as like organic psyllium husk is one way that you can also help eliminate, to make sure when we go back to making sure we're eliminating, meaning a daily bowel movement, if not 2 to 3 a day, because we have to get rid of the toxins via either our urine or our bowels or sweating. So sweating, we talk to our patients all the time about if you have access to a sauna, that is like one of the best ways to help us eliminate things. And I've had patients where they've taken mercury out of their diet, supported all the phases of the liver, did daily or at least 3 to 5 times a week some type of sauna, and their levels have come down, and they don't have a problem anymore. So it's not something that you have to live with this your whole life.
Okay, so you can get ahead of or what, recover from osteoporosis? Is that
You know,
part of
that's
what
a
you're
that's
saying, or slow it down, or
you would I wouldn't say necessarily recover, because osteoporosis is a really long-term process. It's not something that just happens from day 1 to day 2. But it is important to understand the average age of menopause is 51, 52 for women. When you hit menopause, that's when you have, we call it almost an exponential loss of bone right after, because the hormones are protective for our bone health. And so if you can work on things during that time period, that would be the most important in my eyes. Now, I have had patients when they've had osteopenia, that's the very beginning of bone loss, that they actually have reversed it through nutrition. This one patient of mine, she did yoga almost every day and took away things that lowered her bone density. So caffeine, alcohol, processed foods, and also extremely high protein diet can also contribute to some bone loss over time. And
high protein?
too high of a protein, we need protein. And as a fact, as we age, there's a term, I don't know if you ever heard of sarcopenia. That's where older people lose their muscle mass and they replace it with fat, and they could be normal body weight, but they've lost all their muscle, and they actually need a little bit more protein as you become into your 60s and 70s versus when you're in your 30s, 40s, and 50s, unless you're an athlete and you're building muscle mass type of thing.
But you're saying that osteopenia can be as a result of too much protein.
Too much protein, in addition to alcohol, caffeine, and lack of weight bearing exercises. Certain medications can also contribute. If you're on a anti-seizure medication such as Dilantin, that can contribute also to thinning of your bones. You have to look at many different causes in individuals. And a lot of it is, and I have seen this, so it's a lot of women with extremely low body weight, societal pressure to be thin. They also have an increased risk of having thinner bones, basically. But there are metabolic processes with the parathyroid hormone and other things that can contribute to bone loss. So you have to make sure that you actually have a full evaluation, even by a bone specialist and as an endocrinologist. But from a functional medicine standpoint, we can augment and be adjunctive in terms of healing, making sure there's adequate calcium. Vitamin D is another one. I can't tell you the number of patients that are like vitamin D deficient, especially if you live in parts of the country where there's no sun. But then you can live And
Or COVID, where you're inside all the time.
exactly. Or you live in Florida and California, but you wear sunscreen and you're not outside because there's too much sun. So it could go both ways. But I think more importantly, I think we tend to eat a healthier diet from the get-go. We're talking when we were born, basically, but even in your 20s and 30s, you could help prevent some of these things like osteoporosis from occurring. And making sure you're doing exercises that are weight bearing. Swimming is wonderful, but it doesn't contribute to your bone density like if you were to do weight, even walking. But anything that causes stress on the muscles, yoga, for example, if you're doing the sun salutation and the downward facing dog and whatnot, that is going against gravity, and that's going to also help with your bone density.
So Pilates is also another good
Mm-hmm.
exercise for that. So, okay. So it sounds like, because I want to keep, you know, giving a very tangible things as we're talking about all of these topics. This is lifestyle. This is again healing, power, growth, all of the things that affect us emotionally and physically that are affecting our ability to move forward in those things or stagnate in those things. And for women who feel chronically stressed, chronically triggered, uh, have food sensitivities and allergies and gut bloating and all of these things, what we are circling back to is that Dr. Bradley is saying that living in that chronic state of fight or flight releases uh, chemicals in our brain that cause inflammation, and the vagus nerve, which connects the gut and the brain, also gets inflamed. So it cannot properly function, which means that the happy hormones that are in our gut don't make its way up to our brain, which is why we're saying our moods are so irregular. Women, ladies, it's our food is part of that. And um, but it's also caused from the underlying trauma or stress that's triggering us. So we have to be aware it's either the things that we're putting in or the physical things that we're putting into our system or the emotional things that are in our system that have never come out, have
Mm-hmm.
never been processed out. Is that correct?
That is very correct. And the other thing I just want to preface is that sometimes we've had trauma that is unidentified, and it is important to work with a certified specialist, behavior health specialist, a licensed social worker, someone who knows and can help navigate this with you. Because if you've never let the trauma be voiced or come to our cognition, a present thought, it could be overwhelming. It could be extremely um, triggering. And I think it's important for individuals to definitely work with someone who can help guide them through this
To
healing
help process.
process. There's something else called somatic therapy, which I'm finding so helpful for so many of my patients because the trauma that you incurred then causes cellular damage, which then causes our cells, which is a somatic pain, for example.
So, Dr. Bradley, you were saying that somatic therapy is a good way as well. And somatics are it's motion or movement, and also people hearing this, there's trauma, and obviously, if you have any kind of trauma or emotions to work through and process, it's always great to be in the hands of someone who's licensed that can walk you through that.
Mm-hmm, mm-hmm,
But
mm-hmm.
but women need to also know you don't have to know what that trauma is. I think what
Right.
you're saying, and that what we understand is that we all basically have trauma. And if we know that we've been traumatized or have some trauma that we have not processed if we are suffering from these symptoms. So if you are suffering from any of the emotional things or the physical things that we've been talking about with gut, with emotional triggering, with mood sensitivities, with self, with
Mm-hmm.
the internal self dialogue, those are indicators of trauma. So knowing that, then we know that there are things that we can do to help regulate. And those things you're saying are activity, going for a walk, breathing, yoga, hot saunas, um,
But let's talk about
cold plunges,
yeah,
things
yeah,
like
yeah.
that. Yeah.
Let's talk about specific exercises you could do after we're finished with this podcast. And this is for your vagus nerve. And one of them is gargling. I always explain to my patients that, you know, when you gargle with water, you're protecting your airway, and your body will do everything possible to not only protect it, but then when you are doing it, the rest of your body just totally relaxes because you can't be stressed and gargle at the same time. The two of them do not work. So actually, I want to challenge everyone, get a glass of water, make sure it's filtered, and gargle for 10 to 20 seconds and just get this observation of what's happening with your body. That's a simple exercise that helps with regulating your vagus nerve. Another one is humming. My husband doesn't like when I hum, but I think humming is the most wonderful thing in the world because it, once again, the vagus nerve affects our swallowing, and this is where your voice is. And when you're humming, you're helping with regulating that. And the other one is that heart rate variability. A lot of people are having a lot of devices that will show them what their heart rate is. But when you have heart rate variability, it actually is, once again, the vagus nerve affects our heart, helps regulate our heart rate. And when we are working with heart rate variability, it helps the whole body, not only with the vagus nerve, but also helps your heart. And because you want to have resiliency also within your heart muscle. There's something called heart math, which I think is a great biofeedback for our patients, where they actually have this Bluetooth technology where they're doing their heart rate, and then they have an app that tells them, so I want you to start breathing. I want you to do some deep breathing. If you take a breath in and your exhalation is longer than your inhalation, it's called the 4-7-8 breath. You take a count in on 4, you hold for 7 counts, and then you breathe out slowly over 8 counts. This actually engages the parasympathetic nervous system, which calms things down. And when you're doing the heart rate variability, you can look to see, is this actually improving my heart rate variability? And
I
if it
feel
is,
calmer
then
already.
you know that it works. Isn't it wonderful? I always tell my patients, this goes back to also mindful eating. Do the 4-7-8 breath prior to each meal. All of a sudden, you'll release your gastric juices. It'll be like a better acceptance, and it helps with your intestinal motility. Do it before you have to give a big presentation or talk to your boss. Do it while you're sitting in traffic. How many times you're at a traffic light? And I tell my patients, do a 4-7-8 breath. And the other
So
thing
it's 4 in through your nose or in through your mouth?
through your nose, hold for 7 counts, and then slowly breathe out through your mouth for 8 counts. And there's another really quick little technique you can do when you're sitting in traffic. We hold tension in our head and our jaw. You take your tongue and you put it at the top of your mouth, uh, drop your jaw down, and just let everything relax. And it's amazing what release it's giving you. And we clench. A lot of times people clench and hold on to things when we're stressed all the time. So these are basic things you can do daily. The more you do, like the gargling and the humming, 4 to 5 times a day, the greater the impact it will have on your vagus nerve. So
that's really, really wonderful. So it sounds like you want to um, certainly refer back to this, and that functional medicine is great in tandem with traditional medicine. You're not looking to leave your primary doctor and go to functional medicine, but um, understand that there are more options out there, and
mm-hmm,
that functional medicine looks at things in a different and broader way,
mm-hmm, mm-hmm,
so that it's not just looking at the source of what's ailing you. So if you go in for whatever it is, a headache, and they're just looking at your head, functional medicine is looking at your entire body to see what could be causing the headache.
absolutely,
And
absolutely,
so it's a full systems check instead of just looking at the specific organ that's wrong or
absolutely,
having an issue. And so we want to use functional medicine in a it's a more holistic approach.
absolutely. And the other thing, Blair, there are some functional medicine physicians who are primary care. They do both. We just happen at our clinic, the Cleveland Clinic, we're a consultative service because we're not going to be ordering your routine mammogram, colonoscopy, all the things for preventive medicine. Or if you had pneumonia, you really do need to have a primary care doctor.
And what is it that women should be looking for if they now want to look into finding a functional medicine physician? What are the
Mhm.
things to make sure are there?
Great question. So the first thing is you want to make sure that they're certified in functional medicine. You can actually go to the Institute of Functional Medicine, ifm.org, to find practitioners that live in your area that you could look for. And, ideally, if they're a physician or an advanced practice practitioner, such as a nurse practitioner or a PA, those would be the ideal choice in my mind. There are some chiropractors and some, I think, others that may be certified, but you want to make sure that they've been practicing for a long time and they're practicing truly functional medicine. I think that's the most important thing to look at.
So it's the website again is
ifm.org.
okay, and that's a safe place to go,
Mm-hmm.
and find a functional medicine physician in your area,
Certified function.
certified.
Correct. Because some people may call themselves functional medicine, but they haven't gone through the training.
And it is different additional training. So
On top
everyone
of,
needs to be
yeah,
aware of that.
absolutely.
Dr. Bradley, thank you so much for your time today. Um, this was really incredible. We appreciate you sharing.
This was wonderful, Blair. Thank you for just doing this. This is like such a great um, place to be able to discuss important things in health, and you're doing it. So thank you.
Thank you.